Good morning and welcome. Let me start by thanking each of you for taking the time to learn the life-saving skills of adult CPR. American Heart Association reports each year that cardiac arrest claims more than 300,000 lives. That's more than AIDS, prostate cancer, breast cancer, handguns, and traffic accidents combined. My name is Belva. Today I will demonstrate for you the basic skills of adult CPR. Death from cardiac arrest is not inevitable. You can make a difference by using what you learned here today to help save a life. So let's get started. Adult CPR consists of three basic concepts: opening of the airway, breathing, and circulation. After a victim is determined unresponsive, you want to call 911 or have someone call 911, and initiate CPR. Let's get started. The victim is determined unresponsive. You want to open the airway using what we call the head tilt chin lift. This is done by placing the palm of your hand on the victim's forehead, tilting it back, using two fingers of the other hand to lift the chin and open the airway. Next, we're going to assess for breathing. We're going to look, listen, and feel. We're looking for rise and fall of the chest and feeling for any air escaping the victim's mouth. If there's no breathing there, you want to go ahead and give 2 rescue breaths. Make sure the chest rises with each breath. Each breath is delivered for 1 second each. Next step is circulation. You want to make sure you can see the patient's neck or the victim's neck. Put 2 fingers in the middle of the neck, slide it down to the side, and check for a pulse. 5 seconds at least, no more than 10 is spent trying to find a pulse. If there is no pulse, or if you're not sure of a pulse, go ahead and start chest compressions. Move or remove the victim's clothing. Place one hand in the center of the chest between the nipples and the other hand on top. Use the upper body weight to push down hard and fast in the center of the victim's chest. Make sure you allow the chest to re-expand to its normal position before continuing with the next compression. Compressions are key because it allows blood to circulate to the vital organs of the body. I'll demonstrate for you a full cycle of CPR before we move on. You can follow along with me using your handouts that I've provided for you, and if you have any questions, we can answer those at the end. Are you okay? I need you to call 911. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Give 2 breaths. You want to repeat this cycle of 30 chest compressions for every 2 rescue breaths until the victim becomes responsive or help arrives. Let's recap. Opening of the airway is your first step after determining the victim is unresponsive. You want to look, listen, and feel for any breathing that may be escaping the victim's lungs. Check for a pulse. If there is no pulse, you will immediately start chest compressions. You will continue the cycle of 30 chest compressions for every 2 rescue breaths until the victim becomes responsive or help arrives. This concludes my demonstration of adult CPR. I hope that you will use what you've learned here today to help save a life. Any questions? Yes, ma'am.
What happens if I'm not sure I feel a pulse?
If you're not sure you feel a pulse, you want to make sure you check at least 5 seconds, no more than 10. Doing chest compressions on somebody who has a pulse will not hurt them more than if you don't start chest compressions. So even if you're unsure, until the victim responds to you, go ahead and start your chest compressions. Any more questions? Yes, ma'am.
Are the steps for child CPR the same as adults?
Almost identical, but there are a few changes. For adults, you call 911 first and then start CPR. For children, you want to do a full 5 cycles of CPR and then call 911. For chest compressions, you can use 1 or 2 hands, depending on the size of the child, and the depth is not so deep. Each compression is 1/3 to 1/2 inch for children. Any more questions? Yes, ma'am.
Is cardiac arrest the same as heart attack?
Good question. No, ma'am. Cardiac arrest deals with electrical function of the heart. In cardiac arrest, the heart stops suddenly and unexpectedly. A heart attack, patients suffer from heart attacks due to lack of oxygen or blood flow to the heart. So one is an electrical problem and the other one is, we can say, plugged up pipes. The blood can't get to the heart, so it suffers from lack of oxygen, not electrical malfunction. If there are no more questions, I'd like to thank you for your time. Remember the ABCs of CPR and help save a life. Thank you.